and welcome back with our first conversation this morning. It is all about Medical Lab Professionals Week. We have the folks in from Lab Services to tell us why this week is so important. Joining us on set, we have to my left, Miss Rochelle Cabral, who is the Director of the Lab Services. Good morning.
Hi, good morning.
Next to her is the Blood Bank Supervisor, Mr. Adrian Martinez. Good morning. And then to my right, we have the Hematology Supervisor, Mr. Deon Young. Good morning. And next to him is Miss Milka Sinfuegos, who is the intern at the Lab Services. Good morning.
Good morning.
So it is all about Medical Lab Professionals Week, but I'm noticing here that it is particularly to the blood lab services. Are we talking about the hematology expert here as well as the blood bank supervisor is in with us. So let's talk about the difference between a lab professional and a medical lab professional. Anybody want to take that?
We could perhaps start with the director. Is there a difference?
Right. Hi, good morning, everybody. So I wanted to start off by highlighting the theme for the week.
Go ahead.
Sure.
The future is lab.
Sure.
And I just wanted to correct you. The lab week is not only for hematology and blood bank, but it encompasses all that we do in a lab profession.
Okay.
And the difference between a lab profession and a med lab technician is that a lab profession, it includes everybody that makes the lab run.
Okay.
Which means the domestic, the driver, the administrative staff, or medical technicians. We even have a pathology unit. So it's not only med lab technicians that make up a lab, but also, different agents, different pieces that come together to make what we know as a lab in Belize.
I think I'll ask the question, what generally happens in a lab? And I would imagine it varies based on the type of work that's being done in a lab.
Right.
But when those outside of the laboratory that doesn't necessarily understand the intricacies, the ins and out,
Right.
perhaps just looks in and say, oh, that's a lot of science stuff with tubes and people that got goggles and white gown, and then they create clone humans, for
Right.
example. What happens in that?
It used to be something that we don't really hear about in the past because
Yeah.
it started in 1950s at the Belize City Old Hospital. And it really started where there were a bunch of doctors that needed to do some x-rays and they said, let's do a lab. But it grew from there. In the 1960s, we moved over to our new location, which is at the Princess Margaret Drive. And we expanded our services and our scope of analysis, which includes chemistry, hematology, microbiology, pathology, molecular biology, and blood bank as well. So one of the things that I wanted to say with what you said is that, basically what happens is that we get samples, we test them, and we give you your results.
Okay.
Without these people here, doctors can't diagnose much
Yeah.
because they're going to just rely on physical conditions or your symptoms. But with what these guys do is that they're able to get a sample from you and to tell you, what's in it, what's causing
So
the
a
problem.
So when a doctor says, I
Right.
need to get a urine test or I need to get a blood test from you,
It goes to the lab.
these.
Yeah, we collect the samples and then these are the guys that test it and see what's in it
Okay.
On a daily basis.
on a daily basis.
So just for clarity, it's not the doctor himself that goes in a little room in the back, does some testing, whatever
No.
comes out and said this their result. You
No.
actually have trained and qualified people
Right.
in a laboratory that offers that service.
Right. So the University of Belize is a very good institution because they train these people. They have a bachelor's program that this young lady is currently pursuing. And so when the doctor goes to the back and gives you your little lab paper to do your lab work, he doesn't do the magic.
Wow.
These guys are the ones that do the magic.
That's so important to highlight.
It is
Right.
important to highlight. I wanted to get into the actual nitty-gritty of what happens behind closed doors because I think that's what people have this misconception that the doctors are the ones that does the magic, if you will.
Yeah.
Right. So when you are at a clinic or at a facility, and you were needed to provide a blood test or a blood sample or so forth, or this person needs blood, how do you know what are the tests that you have to undergo as a hematology supervisor?
Well, to be honest, when the patient sees the doctor should basically speak to that patient, basically letting him or her know exactly this is what we are going to order based on the examination that the doctor had with the patient. He will order certain tests. Now those tests, you take the little paper to the lab and you go to the accession unit. We will log your sample. We will collect your sample. The phlebotomist will collect your sample. Then it is taken to the section of the lab where it's tested, validated, and the results are released.
Is
Okay?
there ever a time or a place that something has been mixed up, or there has been a mix of this blood is not the correct blood? What would happen if you have the wrong samples, that perhaps you need to give a blood transfusion and you have the wrong samples?
Well, to say something like that, accidents happen, but I can't say for us, right? But in the event that something is amiss or something you don't understand or something is not clear, you would ask for a different sample. But everything, the sample is logged, tagged, and taken. There are steps that you go through to prevent things like that from happening, because at the end of the day, our job is to ensure that we help people and not hurt them.
So on a date, so I would imagine that as the supervisor, you have a team working under you.
Oui.
What's your team size, if you don't mind me asking, even if it's one person?
Well, some departments have multiple people. Some
Okay.
departments have 2 or 3 people. At the moment I have one person working with me.
Right. See, I figured that much. And how many samples would you say you guys go through on a daily basis where hematology is concerned?
Based on the amount of patient coming in and samples, because remember we are a referral lab.
Yeah.
So
Okay.
you could get sometimes 50, 60 samples,
Okay.
per day. In some areas it's more than that, because since it's
I
referral.
just wanted to plug in.
Go ahead.
Just to celebrate them.
Yes.
Last year,
The statistics was that these guys, our lab technicians, did over 500,000 samples last
There you
year
go.
in 1 year. So that's literally like half a
Give
million
yourself
samples
enough
that
credit.
they've done in 1 year, which tells you the volume of work and the dedication and commitment
So-
these guys do to put in to make sure that these tests are run and the samples are
Right.
done.
How big is your staff?
The technical staff is about 35 people, and administrative-wise, we have about 10 people. So it's you know,
About
it's a
45.
decent staff.
Yeah, it's
decent
a
staff.
nice size.
Yeah.
I wanted to get Miss Cienfuegos into it because she is an intern currently, like studying at the University of Belize, and you are in the lab tech program.
I'm studying bachelor's in medical laboratory science at the University of Belize.
And why did you choose this field?
For me personally, from I was a young girl, I was more attracted to the sciences. And so when I found out about the medical laboratory profession, to me it was the right fit. I'm not much of a people person, and when in comparison to nurses and doctors, they more have that personal contact with patients. I prefer the behind the scenes. So, in addition to that, I think that being a medical scientist is of much importance. We are very essential. We might not be recognized as often, but I think we are very essential in the health field. For example, during the COVID
I was
times,
going to say.
they were working like day and night
Yeah.
to get out those results. So,
You know, April, it was during COVID that I actually got the opportunity to take a brief tour of the lab services department, right? It's the building there on Princess Margaret Drive, to get an understanding of the work that these medical lab professionals were doing. And I was amazed by the fact of how you guys had to adapt to the new realities, to the new information, to the new technology, all to give Belizeans this information in numbers and data and stuff that we could understand. You broke down all this technical and complicated information to either heighten our awareness. So they were really the ones in the background that kept this nation afloat in a manner of speaking.
And that is why we have to have Medical Lab Professionals Week.
Yeah.
Right?
Yeah, I feel like we're celebrating here
Yeah.
right now. But I wanted to bring the conversation to Mr. Martinez as well, just to talk a bit about your work as the blood bank supervisor. What is the scope of your work, what you do, and stuff like that?
Okay, as a blood bank supervisor, we work hand in hand with all the different laboratories that is countrywide. At the blood bank, we collect, we store, and we provide blood for future uses. We got different type of blood components. They have different shelf life. So the outpatient will usually walk into a laboratory, do their lab test. 70% of the cases will be diagnosed by the lab. Then they will do the follow-up. When it comes to the follow-up, then is where the blood bank will come in, get in contact with the physician and the laboratory. And we have a number system. We always work with numbers. And we have a body system that we could always prevent errors, so that we have a safe system to transfuse blood.
Okay.
How many persons are in your department?
We have a national blood transfusion services that is Belize City. We have 6 staff. We have a network that is, we have different hospital-based blood bank at every regional hospital.
And I understand that Ms. Rochelle said that you all are a referral service, right? So you work independently outside of other medical institutions.
Well, the lab is a national reference lab, which means that all the district labs, they send their samples for us to confirm or read their test. When they can't do it, we do it.
Okay.
So we're the national referral lab. And we also are, we deal with public health. Any public that come in, we are able to test their samples as well.
Yeah.
Let's talk about the Medical Lab Professionals Week. And I know you have it's a week of activities. And can you highlight the theme one more time for me,
Right,
please?
the future is lab.
The future is lab. Tell me about the theme.
All right, so the team is very inspirational.
Yes.
It's something that these international organizations come up with, and we just go with it and celebrate. It's very important for us to highlight. I was so amazed to bring this intern here because I wanted to have young Belizeans that are dreaming about what can I do in science? How can I help people? And as she said, be in the background, not really in front of people. And the med lab profession is really a way for you to give back to the country. It is the future of Belize because every year we have so many graduates from UB that are coming with this degree, this knowledge.
Wow. Okay.
It's a bachelor's degree, it's not just an associate's. So it's very hard to get, it's very time consuming, you have to be very patient. And you do internship where you go to a lab and you have to work for free. Give them your skills and you learn as well. You learn on the job and you learn as you go.
So is there an area in particular you're thinking about specializing in as you move forward?
Me personally, I like the field of microbiology. So I am very interested in expanding my knowledge in that specific field. And I also wanted to gravitate to more of the forensic side of the lab. Whichever opportunity presents itself, I'm very open to it.
How many students are in your class?
Currently doing internship, I think it's around 18 or 19 of us.
Okay.
That will be completing the program in June.
And because the director said that you learn other things at the lab itself outside of the scope of school. What is one thing that you learned that you didn't expect to happen at the lab?
I think during doing the theory in class, and when you apply it, you do the actual work. The thing you have to adapt to the most is the workload.
Yeah.
So you come in, you didn't expect the workload, you have to adapt to that. You have to learn new skills on how to do it faster and at the same time doing it right. So I think that's something that I really had to pick up on.
You think that this is the career for you?
Yes, I think this is it.
So in line with the team, let me ask you, Director, what is the future of lab in Belize?
Wow.
It's a
that on me.
loaded
I am putting that
question.
on you.
Well, I am happy to say that with our Ministry of Health and our One Health approach, the lab future looks very innovative. It's highly technical, skillful, very knowledgeable, because all our technicians come with a certain level of knowledge already. It's innovative because while diseases expand and it change and it modifies, we are also able to expand our own instruments so that we can be able to detect anything. We're able to, detect whatever it is that we need to provide a service for the public. So the future of it in Belize, it's very exciting. It's expanding.
Are there still challenges and hurdles that we have to cross?
Like everywhere else in the world,
Okay.
there's challenges. Some things that, human resources is always where we need more people
There you
because we're
go.
doing more work.
Yeah.
So human resources is our challenge, but we're dealing with it because we get interns, we get people that come to work for us, and some of them stay. Maybe we can hire her as well. So
There you go. You
you
got a
know.
job right there on set. Hired.
right.
But how do you look at the progression of Belize as a country compared to other societies in this field?
Wow.
Yeah, let me ask my
So,
good friend over
you know,
here.
Quite people might say Belize, but Belize is a third world country indeed. But in comparison to some of our neighboring countries, like in the COVID testing, when other countries were short on supplies or were not getting through to their people, Belize was on top. We have very good donors. The Ministry of Health and Wellness was on top of their game. So quite contrary to we are in a third world country, the technology that our labs have is first world. So quite contrary to what people might believe, oh, it's a government service, yes, but the government ensures that they have the minimum, least best possible standards at its minimum for the country and people of Belize.
I really appreciate that you said that, because I think that during the COVID time when everybody was in a strict panic, you all had to remain composed and do your job. So if anybody knows that, it's you all. In terms of what you would like to see as you all continue to progress in your field, what do we need in Belize?
What do we need? We have the equipment and the people. What we need is probably infrastructure. We need a bigger lab. We need to expand. We're expanding services. We would love to add more scope of analysis. We do a lot, but we would probably want to see an expansion of infrastructure so that we can really accommodate the work we do and the staff we want to hire and the future that we want to keep going in this country.
Okay, well, let's talk about the thing that you were all here to talk about, which is the activities for the Med Lab Professionals Week. What can we expect? When does it begin?
Tomorrow we're having a blood drive at Belize Healthcare Partners as part of our activities. All are welcome to go and give blood. A biomedical examination will be done to all donors, so everyone is welcome.
Let me ask something before we continue with the other activities. Is there a certain amount that your blood bank can hold, or a certain target that you aim for every week, every month, or during these drives?
Well, all blood donors are welcome because when it comes to voluntary blood donation, that's the safest blood we could collect. When it comes to storage, we do have capacity. We do distribute them. We do components every day. So they have different shelf life. For example, platelets will be 5 days. Fresh frozen plasma is 1 year. Packed cells or whole blood, that is 35 days. So we do find a way of distributing all our products to the different private and government hospitals.
Is the need and the demand for this so high that you're able to turn it over within that period of time?
Well, we're a blood bank, so
Yeah.
money goes and come back.
No, well, I'm glad you asked that, because I was going to say there are times when I see my friends posting on Facebook, we need blood for this, we need blood for that. So what occurs then?
I think it's a culture. We
Okay.
need to improve this culture. We need to change people's mentality because sometimes if they know that I'm a blood donor, they will always come to me. A person can only give 1 pint of blood every 3 months. So we do have criteria. If you're O positive, you need to get an O positive blood donation or O negative, but then in the blood bank we collect all different type of blood. We have 10 different type of blood types you can donate. And the problem is that sometimes we got some temporarily and defer criteria and some permanently. When you go to the blood bank, we explain you, and then we do encourage you to come back, and then you could try again.
How do you know when somebody qualifies to give blood?
First of all, you need to meet the general criteria. You need to be healthy.
Okay.
And no
so
drugs,
you can't
no-
just look at somebody and say they're healthy though.
Yes, we have a nurse Madriel. She have a long expertise in blood bank, and she will run you down through all the questionnaires, and we will do your blood type, we'll do your blood count, and from there, based on the general checkup, then we proceed.
Okay.
So apart from, so the blood bank is tomorrow, the blood drive is
Drive.
Yes,
tomorrow.
tomorrow.
At what time?
We will start at 9 o'clock and we'll finish at 2 o'clock.
Okay. And what else are we expecting for the week?
Thursday, we have
Well, tomorrow we're having
Wednesday.
patient give back day where we're going to give patients some fruits, you know, just to
Fruits?
stay healthy. It's a part of our health
Okay,
initiative.
Great.
Thursday we'll be having our big health fair. So
Ah.
on our compound we'll be having you know, information, testing, and this is a good initiative because it includes not only public lab, which is us, it also includes the private labs.
Okay.
So the private labs will be a part of the day, and as well as other different organizations that are going to be there to just inform the public of what's happening, you know, and things like that.
So where is the compound at the lab services?
The lab services is located on Princess Margaret Drive. It's next to the Carlisle Memorial Hospital.
Okay. And wrapping up the week?
Wrapping up the week on Friday, it's Staff Appreciation Day. You have to give them back something.
yeah, of
course.
So we'll be feeding them basically. We'll be giving them like a day to eat and relax, and you know, just to still do work, but eat, you know, and you know, relax a little bit.
In terms of, and we're wrapping up the conversation, but I'd like to ask what are a couple of the lessons that we learned during that fast-paced, highly demanding COVID season that we're now taking with us when the calm has come, and how that has helped to grow and strengthen the services we have.
Right. So I wasn't there because I'm a new director, but
Yeah.
let me tell you what I can tell you. We learn as a country is that we need to prepare more, be prepared, and to always, you know, keep track of what's happening in the world. You got to be prepared and know what's happening so that you can be able to fight whatever it is that may come to you. Because this will happen again. Another big pandemic will happen. It's happened in the past, so we just need to be prepared.
Yeah. Final words from the hematology supervisor.
Well, I'd just like to thank you guys for having us here. I'd like to tell my colleagues, my interns, wish them all, and when I say my colleagues, because like the director mentioned previously, it's not just the medical technologists who are the laboratory professionals. It encompasses everyone, so everyone that helps the domestics, the driver, the people who log and tag the samples, the pathologists, all of them, we all make the magic happen. So I'd like to wish all my colleagues a very happy professional lab week, and the interns, and hopefully we can inspire people out there who are looking at this show to join us, because it's a it's a profession of love. If you want to help people, if you want to do something for your country and for your people, it's a wonderful way of giving back. Will you become a millionaire? No. But if you're into people and helping, this is the profession for you.
I love it. Thank you all so much for joining us. Happy professional medical lab professionals week to all of you. And thank you so much for all the work that you all do. And I think I can say that for all of us in Belize, thank you so much for everything.
Thank you for having us.
And with that, we are going to take a break. And who do we got next?
DJ.
DJ is coming with us after the break. Stay with us.